With that short introduction, I want to record a few apologies. Dylan Roberts, Jill Harris, and Helen Stevens-Jones. Are there any further apologies? No. Could we also note there were difficulties on the A55, especially around the Conway Tunnel today, so there may be some late arrivals. We have explained to them that it's important for them to take as much time as needed to arrive safely, of course, so there may be some that will arrive later. The next item on the agenda is the declaration of interest for the current agenda. Are there any matters in relation to the current agenda that need to be considered? No. Thank you. The next item is a review of the register of declarations of interest for hospitality and goods, and there is a register that has been presented with the papers today, and there is work also to be done in relation to hospitality and goods. Phil, do you have anything to add at all as interim board secretary?
Fel Micyn dwi, os Gwynaf both dros dro, dwi, interim board secretary. So thank you for that. So I just want to say a couple of things. It is within our standing orders that we publish a copy of the board members' register of interests, and it's good governance practice to kind of bring it to this meeting and make sure it's openly and transparently shared. It is a live document and it is updated regularly and published on the website. I am asking the board to note the current register. I'm also asking the board members to continually check it and to alert me if there are any other matters which they wish to raise at the meeting or after the meeting, and we will update the register. That's really the ask, Chair, of this item from me. And second point, in terms of the register of gifts and hospitality, similarly, in line with our standing orders, board members and employees must declare in the register of gifts and hospitality. And because we have new members of the board, it's important that we are again transparent and open. And my ask of the board is that we share that at the next board meeting too, in a similar fashion.
Diolch yn iawn. Pawb yn hapus efo unrhyw gwestiwn?
Everyone happy? Any questions? Are you happy to approve the register and to ensure that we create a register for gifts and hospitality? Vaughan? Could I please add that I am employed by Anglesey County Council and that I'm also a member of ADS Cymru?
I think everyone knows this, but just for full completeness and transparency, my substantive appointment is with Powers Teaching Health Board. So it says appointed from 3rd of May, which is absolutely correct. But if you can just add in seconded from Powers, that would be great.
Diolch yn iawn. Angela?
I noticed that Powers provided on the local nursing and also the nursing. I was away when this was pulled together, so
Sure,
just to correct.
Diolch yn iawn. Pawb yn hapus i dderbyn y gofrestr?
Happy to approve the register. Thank you.
I'll just go back to one item, if you don't mind. I completely forgot, in all the excitement, to introduce Andrea, who's joined us for the first time today. And Andrea, croeso cynnes I gyfarfod yma o'r bwrdd.
Warm welcome to this board meeting.
Board meetings to introduce themselves and to get their names out into the big wide world. So perhaps you can just introduce yourself and say a brief word.
Yes, of course, yes. My name's Andrea Hughes. I'm here undertaking an interim Director of Finance operational role. I'm actually on secondment from the Welsh Government for a period of up to 12 months. And it was a voluntary secondment, so I've asked to come and help out during this time. I've said 20 years in Welsh Government and then 13 years prior to that working in the NHS in North Wales.
Diolch yn iawn, Andrea, and it's really great for you, for us to have your insight and all the experience you have. We really look forward to working with you. Croeso cynnes I cyfarfod heddiw. Apologies for that, for going back, and apologies for missing you out in the introductions. Reit, ymlaen i'r eitemau nesa. On
to the next item. There has been an opportunity for anyone to present questions today, but there haven't been any questions. So we'll move on to the next section, which is the strategic section and the annual plan.
The next item, and we have had papers presented, and I will turn first of all to Carol and then to Chris, and I will want to just to be absolutely sure what is the ask from us today and what was the progress with the work. But I'll turn to Carol, our interim Chief Executive, to begin with. Diolch yn iawn, Carol.
Diolch. Thank you very much indeed. I'm just going to say a few words of introduction and then I'm going to hand over to Chris. So there is a requirement under legislation here in Wales to develop a medium-term plan, 3-year plan. It's called the Integrated Medium-Term Plan, and that is a requirement of all health boards. Given the position that we're in terms of special measures, but also some of the significant financial challenges being experienced by NHS Wales at the moment, most health boards, if not all health boards, are submitting an annual plan. So I need to make you aware that in doing so, we will not meet the duty that is put upon us in relation to integrated medium-term plans. However, we've got an annual plan. It is due to be submitted to Welsh Government on the 30th of June, and it's here today for discussion and approval. Pending there may be some alignment modifications post this discussion, but nothing material. If there is something material raised today, clearly we would take that into account now in the next week or so. We know that as part of our special measures response, we're going to be having a planning review. That indicates really the journey we have yet to travel on becoming a fully mature organisation with planning. So this is in some regards a step towards becoming more mature, but as an executive recognise that there is still a lot to do in terms of our planning capability. There are some clear ministerial priorities and they have been given absolute regard in this, and you will see very clearly, I hope anyway, the read across to the special measures response plan which we approved at the last board. So I'm not going to go through the detail. I'm going to hand over to Chris, if that's okay, and thanks to Chris and his team for the work in bringing this forward.
Thank you, Carol. Thanks, Chair. I'll step over to the lectern, I think, because there's quite a lot of slides and I can drive through the slides more easily from there.
Is that microphone working as well, I wonder?
That will be recorded, that might be.
No, okay, so
in which case, then perhaps it's somebody.
Someone can move the slides for you, Chris, and perhaps you return back. Richard, would you? Actually, if you're taking the minutes, I'll do that.
Okay. So in your pack, there is a document that looks like this, and this slide pack. And just in terms of context of how we've approached this, this document is a much abridged version of the narrative version of the plan, which board members have seen in draft form a month or so ago, and we're still doing refining work on that. And this reads more closely across to the final plan, which will be completed over the course of this week, as Carol has outlined. The shorter version really focuses down upon our delivery objectives, pulling those out of the wider narrative. Over the course of the next week, we will be finalising the milestones that sit underneath the elements in this document, so that they will be complete for submission to Welsh Government on the 30th too. So the version that you have here today is still being worked upon, but the overarching objectives within it are the objectives that we put before you, having considered everything in the round. In terms of the statutory requirements, as Carol has just outlined, there are expectations of the plan. Sorry, hadn't expected to be working in stereo. So there are the statutory requirements, as Carol has said, which we're going to be unable to meet in terms of an IMTP. There are also a couple of other areas of statutory requirements when it comes to NHS planning, and they relate to our planning in partnership. So in terms of our regional partnership board partnership, that is underpinned by the Social Services and Wellbeing Act. And in terms of our 3 North Wales PSBs, Public Service Boards, that is underlined by the Wellbeing of Future Generations Act. And the plan in front of you today entirely aligns with the activities that we've been doing in those partnership arenas and intend to do over the course of the next 9 months or so. Just a few slides then in terms of the strategic and operational context in which we're currently working. All good plans have got to start with understanding our population needs. And you'll see in the longer narrative plan much more on this. But for today's conversation, I just want to give you assurance that this is absolutely rooted on the foundations of a strong population needs assessment. We work with the RPB in doing that and supplement it with our own additional health-specific information. They take into account things like long-term condition prevalence and other risk factors like smoking, obesity, and the many social determinants of ill health, such as poverty and deprivation. You'll see on this slide, in terms of age, over the next 20 years or so, we are expecting a decrease in the number of children and adults under the age of 64, and we're expecting a significant increase in adults aged over 65. And so we need to be planning now in terms of how we will best address the needs that will fall upon health services. In terms of long-term conditions, you'll see on this slide the sort of most significant long-term conditions. And in almost all of those, we have higher prevalences of those conditions in North Wales than we do across all of Wales. And in fact, across all of Wales, the prevalence is a little higher than across the rest of the UK for most of them. And so we have really quite high prevalences compared to the rest of the UK in some of those key areas. In terms of the operational environment in which our wider system of care operates, I think it's fair to say that that is and will continue to be exceptionally challenging. I've put first on this slide the social care market fragility that we are currently facing. The social care market is under immense pressure at the moment. That impacts upon us, and some of our decisions as a consequence then impact upon the social care market. So it's a really difficult conundrum that we need to fix together. Board capacity challenges have been an issue over the course of the last 6 months and will continue to be an issue for us, and that has influenced how quickly we've been able to respond in a planning environment to make sure that everybody is involved and contributes and improves our plan. And then, of course, special measures. We have taken the opportunity over the extension of 3 months in our annual plan to make sure that we're capturing the important aspects that fall into special measures, so that we're incorporating those into our planning cycle rather than doing them in addition. And that's a really important step, which I think the team have responded to well. We have a raft of other plans and strategies, both within the organisation, amongst our partners, and from Welsh Government and other organisations, and we've tried to capture those within our planning processes here. I've listed there just a few of our internal plans and strategies, and they all inform this current plan. What I'd like to do now is just cover the main clinical areas and the main priorities that we have included within the plan for each of those areas. And on this slide, you'll see that we've split those clinical areas into 8 sub-divisions, as it were. And this aligns with the way our colleagues in Welsh Government work. There are areas where things could fall into, into different alignments, but we've adopted these sort of 8 divisions for the purposes of the plan. And if I start with prevention, our planning capability in the prevention and public health arena is good. And colleagues in those areas have been able to bring forward really clear, prioritised plans year on year for us. And that is the case in the corporate plan this year. And you'll see here on the slide that the main areas then in which we'll be focusing our prevention work this year relate to implementing a smoke-free policy. That work is already well underway, but there is further progress that we wish to make on that. We have a weight service plan, which we wish to fully implement through this year. Important work on alcohol harm reduction, and then some early years work, and the launch of a preconception strategy, which sets our population off well in those early years, which should include, and as we've put here, does include for us a preconception. Primary care, in many respects, I could have put dozens of slides in about primary care, because we do need to remind ourselves as an integrated health organisation that 85% or so of our consultations occur in primary care. It's a huge area, and it's far broader than GP services. The first priority you'll see here is, in fact, calling that out, and the further work that we want to do in terms of our cluster development, which brings together partners across primary care, be they health contractors, but also our partners from other organisations, so that we're all working more collaboratively to address the needs of primary care population. The second on here is in terms of a sustainability planning exercise and forward look for primary care services. And this is a really timely inclusion. Those services are under immense pressure as they come out of COVID. and many were under pressure before going into COVID. And this is all at a time when we could and should be doing more in primary care settings. And so it's important this year, we feel, that we spend time doing that forward look properly and being absolutely clear that those services are sustainable going forward to rise to the challenge that we have and that they have in terms of being able to deliver that. The remaining priorities on this slide relate to the contractor services and some specific work in those contractor services. Some important work on prescription performance, both in terms of the originating of prescriptions in general practice, but also in terms of the role of community pharmacy to further improve our prescription performance. Work in terms of addressing some gaps in our dental provision in some areas of unmet need to make sure that we're better delivering in those areas. And some really exciting work in terms of community optometry and some developmental work over the course of the next 9 months, which, besides offering a better high street opportunity for our population, will also help us with our ophthalmology backlog. Planned care is the next of those headings, and planned care is an area of particular challenge for us in the organisation currently, and that includes our operational planning of planned care. It's a difficult field, made more difficult by the large areas of backlog that we have as we come out of COVID. The trajectories in the pack later focus mainly on that planned care space, and we're continuing to refine those. I still believe that there's further improvement that we can make on some of those trajectories, and so it's really important we take every opportunity to do that before we submit on the 30th of June. But then continue to refine them as we move forward and not see them as trajectories that are then set in stone. We need to be dynamic with those. Some of the particular areas in which we'll be focusing this year are on the slide. Orthopaedics has a very large and significant backlog, and it's right that that has a particular focus this year. There are a number of efficiencies in our orthopaedic pathways that we wish to implement this year, and they're efficiencies that some parts of the UK, not all parts, but some parts, have very well implemented and have good experience in which we can borrow and implement locally. There's work in terms of a business case for orthopaedics for a centre of excellence, and we'll progress that during the course of this year. And that's important because even with the efficiency savings within orthopaedics and improved pathway work, orthopaedics is still heavily affected each year when unscheduled care pressure then affects the bed base each winter. I've talked about orthopaedics, but some of those pathway efficiencies apply to many of our other surgical and non-surgical specialties. And so we're implementing efficiencies in those pathways using GIRFT. And GIRFT is Get It Right First Time. It's a national initiative that has been used in other health boards and across NHS England. And demonstrates for us a number of opportunities where we can better improve our efficiencies in those pathways of care. There is further work that we can do in terms of addressing our treat in turn approaches. Treat in turn is a really difficult concept. It essentially means that we take people off the waiting list in the order in which they went on the waiting list. And of course, that's the right thing broadly to do. When you have long waiting lists, then you sometimes get into a very difficult dynamic of weighing across those patients with relatively routine needs but who've had long waits against people with more urgent needs, and balancing those two can be very difficult. We don't think we've quite got that right, and so there is some work here in terms of better addressing that. And then, of course, there is further work to do in implementing the actions we outlined in our vascular plan. Moving to urgent and emergency care. We have refreshed the programme in this area to make it more whole system. Urgent and emergency care is not something that our emergency departments can fix on their own. It's about the whole system, and that needs to progress this year. We're very clear that we are not happy at our ambulance handover delays as an organisation, and so this year there is a clear concerted reduction activity within our plan. There is a lot to be done to redirect folk away from emergency departments where we can offer that care better elsewhere, and that needs to be a priority this year, as well as some work in terms of improving our flow through our emergency department services when people do need to be there, and that relates to some work on same day emergency care. And then finally, in terms of those top level priorities in urgent and emergency care, continuing the good progress that has been made with the Glan Clwyd improvement plan. Moving to cancer. Cancer, in fact, is an area that, as a health board, we do relatively well in. We're consistently first across Wales in terms of our cancer rates. But that doesn't mean there isn't further work that we wish to do or should do. In terms of cancer, we want to progress some excellent work that the cancer team did last year in terms of some of their pathway redesigns by extending that to another 4 key pathways, including the opportunity to go straight to test. Sometimes people go into clinic before going to test, where really it was very clear we could have gone straight to test and short-circuited their wait by doing so. And that's what I'm referring to with straight to test. There is some general work to be done in terms of further improving our cancer rates. And then there's some work to do in terms of some areas of fragility with certain areas of our medical staffing, particularly in the fields of clinical oncology and haematology. The Cancer Division have some excellent plans and have maintained within those the All Wales strategic plans for cancer, and so they'll be progressing those for North Wales as part of this planning cycle. I'm going to move now to mental health, learning disabilities and substance misuse, and you'll see a number of priorities here. There are further priorities within the longer plan, but these are the key priorities. There is a Together for Mental Health strategy, which was signed off a number of years ago in partnership here in North Wales. It's time to refresh that, and work is underway on that, and that is an important piece of work this year, not just for our mental health division, but in terms of how we work in partnership. We've got further work to do in terms of improving trajectories in some aspects of our mental health measure activity, and we want to build further upon the 111 Press 2 rollout, which has gone really well in North Wales, but we now see the opportunity to build upon it. There are a number of staffing difficulties that we've faced in our mental health services. and a plan in terms of how we address those. So that must be a key priority going forward to this year. And then some additional work in terms of substance misuse and in terms of how we bring together the experience for mental health and substance misuse users, where we have identified some significant opportunity. Progressing then to women's services. Women's services have a number of national strategies to implement this year. They have already made good progress in addressing those, but they have further work to do. That includes the maternity and neonatal strategy for Wales. It involves rolling out a digital solution to maternity records. And it includes implementing the recommendations from the Women's Health Plan. And in addition to that, there is some work in gynecology in terms of addressing their planned care backlog that they have. Finally, in terms of those clinical areas, in terms of children's services, we wish to prioritise the Best Start communication plan, and that dovetails well to the prevention work on preconception and healthy pregnancy. There is work to do in our partnership spheres in terms of supporting people with emotional and physical support as young people. You'll see from the trajectories that there is much more work to do in terms of our neurodevelopment, neurodiversity services. Not just in terms of dealing with the backlog, but actually having a sustainable model against which to provide our services, which is one of the reasons that our backlog has been so difficult to reduce. I just have a few more slides before the trajectories. In terms of then our enabling work, I talked earlier about some of the internal plans that we have. We have our workforce plan, which is a 3-year plan. We're now on year 2 of that 3-year plan, which builds well upon some good improvements that were seen in year 1. Within the plan for year 2, we've got work on accommodation. We've recognised that can improve our opportunity to recruit both from overseas and from other areas of the UK. In terms of that overseas and UK recruitment, there are good campaigns underway, which we now need to build upon. But we also need to diversify our workforce and make sure that the right people are seeing the right people in terms of providing care. And so there is further work in year 2 for our workforce colleagues and across the organisation in terms of how we can maximise that opportunity to diversify. Organisational development is really key this year, and there are a number of areas, both within the current 90-day cycle of special measures and likely to be in the next and the next in terms of organisational development. We're undertaking a stock take and consolidation of our operating model, which was implemented in part over the course of the last year. There is good progress, but further activity required to resolve some senior HR cases, and in terms of implementing a development programme for our senior leaders. We have an interims review underway, which we then wish to implement, and similarly an executive portfolio review, which we'll then wish to implement. Digital data and technology is a really important area. It's an important area for this health board because historically we have not managed to resource it in the way that we would have wanted to do. This year, it's really important then that we review the capability and capacity within that team, so that when we are able to find additional funding for digital data and technology, we can hit the ground running, knowing that the plan is good to implement. That's the first action there. There are opportunities to work more closely in partnership across North Wales. We work in partnership across health organisations and across Wales, but there is the opportunity to work more closely in partnership with other non-health organisations across our geography here in North Wales. We want to understand our data so that we can turn it into more mature intelligence, and there's key work within the plan for that. And then we have the existing ambitious rollout programme, the national rollout programme for a number of electronic care record projects, which we will continue to implement. Finally, in terms of enabling, we have our capital programme. And the capital programme includes important work on decarbonisation, some major schemes at two of our district general hospitals, the Myla and Ysbyty Gwynedd. There's some important work in terms of improving our technology, our diagnostic technology, and the use of PET CT here in North Wales, and in terms of replacing some of our radiology equipment. We've previously discussed at board the redevelopment of the Ablet unit, and that work will progress during this year, as well as some important work bringing together some primary care providers in 3 Conwy practices in our primary care and their estate. Last 3 slides then, before I will hand back to the chair. In terms of the finance plan underpinning this, we need to be clear that this is a deficit reduction plan. We are projecting in this plan to arrive at a £134 million deficit at the end of the year, taking us from the current position of £196 million of deficit. It is an ambitious plan in terms of meeting that, and there is a very difficult balancing point between how ambitious we can be in terms of development and moving things forward, as opposed to the absolute expectation that we start to address our deficit and get to a position of balance. In terms of our risks then, there are significant risks in this plan, but we believe that they are balanced and as reasonably mitigated as is possible. The 4 risks here, I think, are our main risks. We have a lot of competing priorities in the health board at the moment, and it's going to be really difficult to address those. The plan you have in front of you strips out many very valid, important areas that could have been included in an annual plan for this health board, so that we are able to focus as tightly as possible on a lower number. There are still a lot in there, but it is a lower number, and we do believe that the contents of the plan are all essential for this year. I've touched upon our ability to deliver against that deficit reduction plan, whilst also addressing our planned care backlog. And that will be a challenge, but we think we've found a reasonable balance point to put forward to Welsh Government and the Minister as a board. We've a number of recruitment challenges as an organisation, and they're long-standing. Our reputational challenges at the moment will compound that, at least in the short term, until we start to turn around some of the areas of special measures. So those two areas present risks for us. Workforce colleagues have looked very carefully at the workforce requirements of this plan, and we consider that whilst ambitious, it is reasonable in terms of the expectations and aligns with our previous recruitment ability and the ability of other organisations in the UK at the moment. My final slide then, other than the trajectories, this plan does fall short of the expectations that the Minister has in terms of backlog trajectories and in terms of our financial position. I've just mentioned how we feel that this is a balance and that we feel we've found a balancing position to put forward. There is a plan, of course, there is a possibility, of course, that the Minister will feel unable to accept this plan. We continue to work against this plan as we await that position if board feel fit to approve it today. The last note then is to reiterate that there is still further work underway in terms of the trajectories that are in the plan. I am unhappy with some of those trajectories, and colleagues are unhappy with some of those trajectories. We feel the data in front of you is reasonable as of today. We're confident that the optimism bias has been stripped out of them as of today. But we do feel that there are further opportunities within them that we're still exploring with our operational teams so that we can, where possible, further tweak some of those trajectories and squeeze out more efficiency. And I've touched upon the areas in which we can do that as I've moved through this presentation. I don't propose to run through every single one of the trajectory slides that you'll see in your pack, but I will pull out a couple of areas to draw your attention to. The first are the slides on new outpatient appointment weights and our treatment weights. And you'll see that there are some large numbers of people there. I think it's important that we recognise that today and recognise that it is absolutely beholden upon us to do that activity to improve the trajectories where possible. For each one of those folk sat on those waiting lists, just being able to shave 1 or 2% of efficiency off our current trajectories will make a difference. The other area is in terms of our neurodevelopment assessments, and the data in front of you is poor. We have a huge number of patients awaiting assessment, and we are some way short of being able to meet the Welsh Government targets. We have put the worst case scenario on these slides because there is some important procurement work underway at the moment to improve that data. I didn't feel it was right to include that in here today because those contracts have not yet been finalised. If they are finalised, as I expect them to be, then we will bring refined data back during the course of the year. But I think it is right in transparent to put the data up as it currently stands. I think I'll stop there, Chair, hand back to you if that's okay.
Diolch yn iawn, Chris. That was a good run through of the annual plan and an opportunity for us to get that overview of where we are. So we'll have a discussion in a minute, but I'll just turn to Carol in case she wants to underline any points before we go for any questions or discussion. Carol.
Thank you. Thanks, and thanks very much, Chris, for taking colleagues through that. So just in terms of next steps, so final steps of refinement dependent on the discussion here today. I then write to the NHS Wales Chief Executive an accountable officer letter to explain why we can't put an IMTP forward, and to give an outline as to the areas where the plan currently falls short on expectations. I'm anticipating that there will be a rapid turnaround of feedback from Welsh Government to indicate their views, and I'm anticipating an accountable officer discussion on the financial position, because the financial position is very, very difficult. If you multiply not just ours, but everybody else's, that is an unsupportable position. So that's the immediate next step. But just to reiterate what Chris said about detailed milestone plan, that supports our planning discipline as we go forward and clarity of delivery. So what will be done by when? Quarterly progress reporting to delivery and performance, and to the board, including exec oversight and the change control process. I will be issuing accountability letters to executive directors, and then we've got the planning review about to start during July and August. Dynamic review process to enable us to bring an internal planning framework back to the board for September, so that we start our planning for next year much, much earlier. So hopefully that's helpful to colleagues to get a sense of where we're going.
Diolch yn fawr, Carol. Felly mae'n gyfle am gwestiynau neu sylwadau, ac yn ni ddigon amser. Please, byddwch yn barod i wneud unrhyw gyfraniad, pwy bynnag ydych chi, cwrs chi wneud unrhyw gyfraniad. Mae gen ni nifer o bobl eisiau holi cwestiynau. Bon, Gareth, Rhian, Claire i gychwyn. Bon.
Tra dwi'n dall bod yna sawl elfen i'r wahanol meysydd sydd yna. Jyst ambell sylw, dy gwir. O'n i'n gweld o dan yr un plant, mae'r trydydd a'r pedwerydd pwynt yr un peth i fi. Dwi'n mynd adeg y gwahaniaeth. So lle bod nhw ipyn o waith angen i wneud yma yna. Jyst i fod yn bach mwy manwl. Hefyd, dwi'n gwybod, mae yna bethau eraill allan ni ychwanegu i'r rhestr yna o marn ni, ond ella bod hwnna'n drafodaeth, ella fysa ni wedi cychwyn efo'r sleid lle Chris yn egluro, mae yna competing demand a fydd rhaid ni prioriteisio hein ar y cychwyn sydd wedi gwneud pyn bach mwy o synwyr mi. A wedyn, yr darn arall ydy lle da ni'n sôn am iechyd meddwl anabledda dysgu. Does am byd am anabledda dysgu yn y 6 pwynt o dan yr heading yna. Does am sôn amdanyn nhw, dwi'n gwybod bod yna strategaetha eitha pwysig, dydy bobl efo anabledda dysgu ddim yn cael mynediad i iechyd yn gyffredinol. Felly, does am byd yn fanna am anabledda dysgu mewn. Mae fydda rhyw token heading, ond does am byd yn y bullet point. Felly, just mwyn tacluso hynny pyn bach mwy.
Diolch yn iawn. Felly, cwbl o gwestiynau penodol yna gwmpas y cynnwys o dan plant ac anabledda dysgu. Chris and Carol, I'll turn to you both. Maybe if you'd like to just respond to one, please.
So in terms of the children's activity, there is a lot of work that focuses upon the attainment of the mental health measures, which is the data that I put on the slides, both in terms of CAMS and then in terms of how we deal with a huge backlog in terms of neurodevelopment activity. And I put those both up because because of the breadth of work that is underway in both of those areas. Neurodevelopment, we can only address the backlog in neurodevelopment if we modernise our offer and consider more transformative ways of how we deliver that, and that's why that was a separate area there, and that's what I wanted to draw out. There is a lot of other work underway in CAMS and in neurodevelopment. It features a little bit more substantially in the main document than I was able to draw out here. In terms of learning disabilities, I need to hold my hands up there to say it was an omission off the slides, but there is clear work in terms of the existing strategy to implement during the course of this year, and some work in terms of some of our learning disability inpatient environment, and work on community residential service, which feature in the long narrative plan, but which I hadn't included on that slide.
Diolch yn fawr, Chris, for that explanation. Anything you wish to add, Carol?
I just wanted to say, hopefully people will find the sort of table helpful as well to supplement the presentation. I think the priority 8 is really around learning disability, still getting to know all the exact strategies, Vaughan, but develop and implement the learning disability strategy is really important there. And then on children's, obviously priority 10 says children, but if I look at the prevention elements, the early years, the vulnerable groups, I think we probably need to pull out that that's children as well. But thank you, yeah, that's helpful.
Iawn, diolch am godi'r mater yna. So, Gareth, Rhian, Claire?
Thank you, Chair. Well, I'm very grateful for the presentation, and I just want to say that the covering the 2-page note at the start is really, really helpful. I know, yeah, I appreciate that everybody's in a really challenging situation, but I do, and I appreciate as well that Carol said about the review of planning, and that, you know, we're in a very, very special set of circumstances this year. I really understand that, but it is disappointing that we can't review the full narrative, because whereas a lot of things that come to the board are really for us to, for information, for us to interrogate, with this, you know, we should have a role in shaping it, I feel, and I know you're giving us the best opportunity you can in the circumstances, but it does sort of worry me. And also just, and I wanted to draw out some of the places where there doesn't seem to be complete coherence between the presentation, which I appreciate, Chris, is like you're trying to summarise an awful lot of information to a small space, but on the list of priorities. So I'm more looking at things that are in the presentation, but I don't see clearly in the list of priorities, which is part of the document. So just a couple of examples. In the slides, it very clearly says, and it's absolutely important, I'm sure it must be there somewhere, concerted action on ambulance handover times at Hawley Hospital sites, but I didn't really see that in the first section, which is the plan. And another one was the reference, perhaps less important, but nevertheless significant, the reference to the work which you drew out on accommodation provision for staff, which again, I didn't really see in the list of priorities. And so more importantly, I guess, was that you presented 8 priorities and 3, I think, supporting priorities, whereas in the first section, which relates to the narrative plan, there are 19, is it, priorities? So, you know, it's just getting my head around that. I don't expect you to be able to answer that now. I'm just sort of saying, well, particularly those specific points about can we just check that they are properly covered in the narrative as well as in the presentation. I mean, the bigger question for me, in a way, is, and, you know, I absolutely appreciate this is a huge organisation, and you have done a lot of work in stripping stuff out that you think we would be nice to do, but we can't. But it does still strike me there is such a huge number of strategies, initiatives and plans. And do we really have the capacity to cope with developing and then delivering work on all of them? And I guess the other point in that is that if, and I appreciate this is a public meeting, but if, as I think we can anticipate, the Minister's going to come back and say £134 million of deficit is not an acceptable basis to plan, then are we already working on what of those things we can deprioritise? Because I think we need to have that fallback, albeit that we can say very clearly that we don't, you know, that if it were left to us, and if we had an endless supply, well, not an endless supply of money, but the supply of money we think we need, that these are the things we would do, and that's where we'd strike the balance. But, you know, we aren't in total control of that, are we? I think when we discussed this informally, I mentioned my sort of concern about how all of this relates to the structures of the IHCs. And again, if you look at the the first part of the document. All the actions are for EDs who are at the centre, as I understand it. And obviously, I know that within that, those will be cascaded down. But again, there's a lack of, to my mind, it may be my ignorance, I'm very conscious of that, but there's a lack of clarity about the articulation of how responsibility is cascaded down. And that brings me on to the trajectories, really, which, Chris, you've been, and I think I really appreciate your honesty, saying, there's more work to do on this. You're not confident about all of them, but just as a matter of process, how far do we think that the IHCs and frontline staff within them are bought into these, and how much are they still things that we think are reasonable? When I say we collectively at the centre, if you like, think are reasonable, but there may not be the same degree of acceptance elsewhere. And then there are a couple of specific points I just wanted to bring up, not so much about unfortunately, perhaps I'm coming at this the wrong end. You're not where I think we should be more ambitious, but where are we confident we're being realistic? So one of them, I look at you, Gareth, was on the diagnostic weights. There's a really quite therapy weights. There's a sharp reduction envisaged, and I'd just be interested in knowing whether we're confident or relatively confident about those, and what the basis for that is. And the other one, which goes back to one of the points I talked about earlier, was there's a very neat sort of steady decline in the ambulance handover weights over month to month, which didn't look credible to me, given what we know about winter pressures. Now, I know that's a fairly pointed detail, but on the other hand, I guess that's the sort of thing that if I were in Welsh Government and scrutinising this, I'd say, oh, come on. Anyway, I'm sorry, that's a lot of things, but and I do genuinely appreciate all the work that's gone into this, and I think we will end up with a plan that we as a board can stand behind. But those are some specific points and a general sort of nagging worry that I would have liked to have more involvement. I'm sure we will have in next year. Okay, thank you very much.
Gareth, lots of important points considered there. So I'll ask Chris and Carol to come back, but so especially around a couple of things. The way we approach the planning for the annual plan, I think, is important, and looking forward, we'll have an opportunity to see how we can maybe engage people in the organisation and ourselves as our board. So it's a collegiate approach, if you like, and we do what we can around that. Then the other sort of significant question Gareth raised is about, what we are projecting, how realistic is it, and is there danger that we are trying to draw a picture that will be acceptable Welsh Government, but we could be setting ourselves up to fail, So I think those two things are particularly significant, but and some of the other detailed things are also important. So Chris and Carol, over to you to give us all the answers on that.
Well, I've just said to Chris, shall I go first? Because I think it's fair to say in the executive discussions we've had the tussle between ambition, reality. We're an organisation that needs to improve on a whole host of fronts, and we need to be able to demonstrate our commitment to that. But equally, we don't want to be so unrealistic that we then, fail everyone's sort of expectations. So I think there's still a bit more to go for us in terms of how we develop that thinking. And for me, I'm 7 or 8 weeks in, getting a sense of, where can we be confident? Where are we not so confident? So I've used, confidence assessments in the past where we go, yeah, we're really confident, that's green, that's going to be green. And then those that are amber, what else do we need to do to move them into green? So that we start to do that. And those that are red, if I think about ambulance handovers, we have got to make them improvements on that, because that's about patient safety, that's about quality. But what else do we need to do to move that from a red to an amber to a green? So there's that whole thing in there. I absolutely agree about the development of a plan must be with the board. And that's why in September, I'm really keen that we set out our stall about, so how do we do a plan around here? And that will include how we engage people. Again, trade union partners, our clinicians, staff across the organisation. What are we hearing from our stakeholders and our communities? And importantly, what are the big things the government are directing us to do? So we've got to put all that in the melting pot, and then as a board we work through that. Just the coherence, I've seen the coherence, so there's, that some of these things have been developed in tandem. We've got a bit of refinement to do for sure. But when I looked at the overseas recruitment, I think the comment was support overseas recruitment, and part of that is about accommodation, and there's a whole host of things in there. Plans and strategies. I think this is one for a board discussion as well, because there's lots in NHS Wales, and then when you add in partnerships as well, you've got lots and lots and lots. I've worked in an environment where we have one strategy, and then we deploy that through strategic frameworks or strategic plans. It's something for us to discuss, but we've got to go through also a prioritisation process at some point. And then the deployment is really key. So at this level, this is about executive director delivery and ownership and accountability, and that's why I mentioned the accountability letters that would go. And then obviously there's the executive director of integrated care services, or director of ops, that gets delivered through the IHCs there. But we can do more work on outlining how that operates or should operate. Sorry, Chris, I was on a roll there.
Thanks, Chris.
I genuinely, I think you've covered it, all the items that were on my list. The only thing was the ambulance issue. It is in there under 4.1 and 4.2, but I appreciate it's in different language and wouldn't be drawn out.
Okay. Thank you very much. Rhian, wedyn Claire.
Diolch yn fawr. O'n i'n trio gweld y cynllun yma mewn cyd-destun, a dwi'n meddwl dyna lle dwi'n cael trafferth ar y funud, achos dyn ni'n gyd yn gweithio ers 3 mis o'r flwyddyn hon yn barod yn dydyn. Felly mae busnes yn mynd yn ei blaen. Felly mae'r cyd-destun yna, a wedyn ymhen blwyddyn, erbyn Ebrill nesaf, byddwn ni'n symud at rhaglen nesaf. A be dwi ddim yn gweld ydy'r camau sy'n digwydd rhwng rwan a ddiwedd y flwyddyn ariannol. A falle bod o'n rhy hwyr rwan, ond fyswn i wedi licio gweld y cerrig milltir. Oedd Carol yn sôn amdanyn nhw, ond dydyn nhw ddim yma, a felly tyson na rhywbeth lle o'n i'n gallu rhoi tic a gweld mae hwn di digwydd eisoes mewn chwarter 1, a fydd erbyn Hydref bydd hwn yn digwydd neu wedi digwydd, neu faint mor bell ar hyd y siwrne ydyn ni. Achos di hwn ddim yn, bod y cynllun yn 1 blwyddyn neu 8 mis, mae rhaid weld o mewn cyd-destun lot ehangach ynde. A felly dyna oedd y broblem oedd gen i, ond dwi yn derbyn falle bod o'n rhy hwyr i osod y cerrig milltir ar hyn o bryd. Diolch.
Dwi'n meddwl bod yna ymgais yn y cynllun i osod allan y chwarteri, beth sy'n digwydd ym mhob chwarter ac yn y blaen. Dwi'n yn gwybod os ydy hwn yn ateb y gofyn, Rhian?
O'n i ddim yn gweld o yn glir iawn yn ystod y narratif gymaint o hynny. A jyst trio, os o'n i rhywun o'r tu allan, o ddim yn deall, falle fysa'n haws i mi weld o mewn darlun o... A hefyd, mae o'n rhoi newyddion da. Dyma be dyn ni yn neud, dyna lle dyn ni di llwyddo cyn belled, a byddwn ni'n llwyddo yn bellach eto.
A felly mae gweld y cynnydd yna yn bwysig yn dydi, ac lle dyn ni'n cael cyfle i weld y cynnydd yna. Dyn ni'n gwybod o ran mesur arbennig, mae rhai wedi nodi o dan mesur arbennig ardderchog, a falle y gweddill, lle dyn ni'n mynd i weld y cynnydd, sut dyn ni'n gweld o, lle mae adroddiadau'n dod ac pa mor gyson. So that's a good question in terms of sort of getting hold of it and understanding the progress and having evidence of the progress. So I don't know if there's anything you two would like to say about that?
Yeah, I don't want to say all this stuff. Really, absolutely, and to some extent, it's the next level that you're looking for, isn't it?
Yeah.
And I agree, and that's what gives us delivery confidence, that we know what we're going to be doing when. Again, I've used a process that I think we can just lift and shift largely, and I'm confident that individual directors will have, their milestones, if not written down, certainly, clearly thought about. But we need to bring that through so that we can track that through, and that will give us delivery confidence. Things will happen as well. So something will happen and we say, actually, we thought we could deliver this in Q2. It needs to move into Q3. We need to be clear about that and how much of our plan is shifting out and how much isn't, because that will help us to understand how mature we are at planning. Of course, the big issue in here for me is that we haven't got cycles 2 and 3 of the special measures yet. And that's the bit that makes this a little bit more fluid for us this year, which I think is exactly what you're picking up. I think our intention is September, possibly November board, to bring Q1 and 2. Now, Q1 clearly isn't in the plan, but you're absolutely right, work is happening. And so we'll try and capture that in order that we've got a proper sort of tracking through. And Chris, your confidence on us being able to deliver the next level milestones?
Absolutely confident. I think you might have forgotten at the beginning to say that actually right now the team are working on those milestones so that we have them for next week. They've driven everybody, half the people around this table, mad over the course of the last few weeks, just chasing down milestones for special measures, for example. So that's absolutely the approach that we recognise we need to take. And so we will have those milestones in place, and we will make sure that the milestones are appropriate so that we can be confident at delivering them, and then be back here, as Carol has said, in September, to be able to clearly demonstrate how we're progressing through those as expected.
Diolch yn iawn. Claire, then Mike.
So I'm going to perhaps start with a positive comment, and then I've got a kind of few questions and challenges, and then some governance questions at the end. So in terms of positives, what was good to see today, I think for the first time, is the trajectories that have been developed. Because actually, I just like the way that the colour's been used. I can see that with some things, we're going to be red still at the end of the year, or we're moving from red to amber. So I like the work that's been done on that. I guess my concern, though, is that it's very much focused in the prevention area and in mental health. We've got a good picture of that this morning, but you talked about the kind of priority around orthopaedics, but there's nothing in here about that. So well done, Teresa, for the work that your team and people have done, because I think that it's good, and I'd like to see that, and I'm sure that's what you're working on, developing much more broadly, because even though it's disappointing to see that we should have no over 52-week waits by the end of June, which is next Friday, isn't it? And we're going to have 10,000 still, but let's be realistic and honest about that. So and not be afraid of that, and not set a target that we think we can't deliver. So in terms of challenges, one of the things that's a biggie for me in here today is that, and mine through Benny, this is not directed to you, Andrew, because I'm sure you can't answer it, is we've got one page on finance. And I cannot see the connection between what's in here in terms of what we're going to focus on, what our priorities are, and the risks or the confidence about getting to that 134. So yes, we know that isn't where we should be getting to. But so if I'm in Welsh Government receiving this plan and looking at this plan, I'm going to look at where Betsy is now, what it's prioritised, where it expects to be at year end, and I will have more understanding of the 134 million end of year deficit target if I can see that against some really credible plans for different service areas. And it just feels to me that that's a huge gap in terms of what we've got presented to us today. I'm sure there's loads of work that's gone on behind the scenes around that, but as a board we can't see that. And as we're measured really strongly in terms of how we deliver, both in terms of patient services and quality, but financially, I just feel that, and I'll come back to that when I talk about governance, I just think that's a big issue for us right now. So in terms of governance, I'm still not clear what the paper didn't say we were being asked to approve the plan, but Carol did say at the start we are being. And I think that we need to be being asked to approve the plan. However, I feel really uncomfortable about, I don't feel I can do that today because I can't see the whole plan. So both the presentations are useful that are in our pack, but I've kind of got to try and join those together in my head and again, I haven't got the finance detail to be able to see what we're saying and where we're heading. So in terms of my request to board around governance is, I think we can only support today the work that's been done today, to date. And I think we perhaps need to have a way, and I'm looking at Phil now, because I don't know if this is the way health boards can operate, but I think we have to have a further step, which is that the board approve the final draft of the plan online. I know in other organisations that's a credible way to approve things when time is short, but I do feel that there has to be another step in the process after today, that, you know, on the 29th or something, we get the final version and we approve that in writing online, with some of the kind of areas that are still under development having been moved on a bit more. So
yeah, we'll come back to that final point before we wrap up the discussion, but the other matters you raised, perhaps Chris and Carol can address those first, and then I'll bring Mike in.
Yeah, thanks very much. If I have a go. Look, the straight answer is we're still having to do a lot of work on trajectories and data and where we can be, what level of confidence we can have. That's the straight answer on it. You'll see within the plan we talk about establishing a revised planned care programme. A lot of work's been done on that, and at least part of that programme will be about improving our data visibility and our confidence in the data and in trajectory planning. And the same with the whole system urgent and emergency care programme, really, about what are the component parts that help us to be more confident about whether it's ambulance delays, whether it's the number of people who unfortunately find themselves a bit stuck in the hospital system and all of that. So there's quite a bit of work to help us to refine those trajectories. And also within there, you will have spotted the development of a performance framework for the organisation. So that's really key. On the finance, I know that Steve brought a finance paper previously to the board that took us through the big issues, the drivers and all of that sort of thing. So further work absolutely is underway, and I'm hoping this is going to help with the governance question, with a paper to board on the further steps that we've taken and what that starts to look like. We've got to at least protect the 134 delivery, but we really should be pushing below that, and there's significant action. And again, yesterday at executive meeting, we discussed that. On governance, I know, Chair, you want to come back to this, but it's not that long ago that I was in another organisation having a very similar conversation. And where the board got to there was to recognise, not on the matter of time, but on the matter of content and the financial position, that, you know, this is they look to support a plan as a working plan and requiring further refinement, but to submit it to the government in any case for their scrutiny. I'm pretty clear and confident that we'll get feedback that says the money isn't good enough and we need to do more. So I think there's a balance about saying, well, we can't submit the plan, to we can submit the plan, but with all of these caveats that you quite rightly flagged to us. Chris, sorry.
No, Chris? Go ahead.
Only, well, no, actually, I don't think I have. The work is underway on the trajectories. I absolutely appreciate that the orthopaedics data, as the example, would be really helpful to see. The reason some of the other data is more clear is because of the way we report it in existing ways. So we will work on that.
So I think what we've been told today is that what's been presented in the papers and in the presentation we've had captures where we are today on this Thursday 22nd, but there is more work to do. There's it's highly likely that government will respond to what we're presenting with asking us to do further work, particularly around the finances. So it's going to be a work in progress that we will need to be consulted further on, I think, to endorse as an annual plan. But we'll come back to that before we get everyone's agreement on the way forward. Mike, over to you, please.
Job Chair, apologies I was late. It meant I couldn't declare an interest and it hasn't made the printed declaration. So I'm wholly employed by Bangor University School of Medical and Health Sciences. I have an allowance of 2 sessions within that job plan to provide clinical work for the board. I'm not employed by the board, so just to clarify that. Because the point I wanted to make is sort of based from a university perspective, which is an interest, obviously. First thing is just a plea from me. I had to Google quite a few of the acronyms, if just that could be borne in mind. It's only a small number, it's not a huge number. Your website is a really good source of info though, because that's where most of the Google's led to. So I don't know if I'm alone in that, but anyway, apologies if I am. Just a couple of points on smoking cessation. I know others may have comments on clarity between vaping, whether it's included or not. A little bit of lack of clarity on that, some of us felt. But I want to make a positive point, and that is most healthcare and medical practitioners are quite reluctant to challenge unhealthy behaviour. That's been shown in many studies. In 2016, the Irish government mandated all Irish medical and healthcare schools to introduce a national curriculum for undergraduate students to challenge health behaviour and to act as health advocates. We've got a large number of healthcare students and medical students across the Betsy patch from 2 universities, and I would suggest we're missing a trick here in terms of P1.2. It's only going to improve once graduates emerge with the confidence and capability to get involved. They often get closer to patients than practitioners do because people open up to the young doctors and the young nurses. So I would suggest that Glyndŵr and Bangor could work together on that maybe, and it's something to bring into the strategy.
Just on that point, just to add, Aberystwyth University as well, although they're not in our region, they do, of course, have students that will be in hospitals and other sites within our region, and an opportunity to work with them as well, I'm sure.
That's an important point because Cardiff has Year 3 students in their carer programme, another acronym.
Yes.
It's Community and Education Rural Route. They have them in both North Wales and Aberystwyth.
Yeah.
And in Year 3, they spend part of the week as health advocates in their community, their small rural community. So that's a really good opportunity.
Sorry, carry on, mate.
Yeah, just on dental hygiene, anyone who's moved into this region like me recently knows it's impossible to find an NHS dentist, pretty much so. The Minister requested our Vice Chancellor about a month ago to do something about this. So just for information, really, Bangor is increasing its dental hygiene intake this autumn from 12, which was last year, when we started, to 30. And we've also been asked to bring in dental health nursing. So I think, again, both universities could make a contribution to improving the dental health of North Wales. And the push at the moment seems to be not to create more dentists, but dental practitioners who are not dentists. But I would suggest that it's not too early to be thinking of a North Wales dental school once we've got the medical school sorted. I think that would be a solution to some of the problems. And my last point is I work for an organisation where if you haven't completed your EDI and D plus training, you're not allowed to interview for posts. Is that the case within Betsy? There was no hint as to what the compliance was on training, and I'm just wondering, is it mandatory for all employees within Betsy? And if so, what's the take-up? And if it's not, is it mandatory for leaders and those who are involved in appointing?
Okay. So, okay. Diolch yn iawn, Mike. And I will ask others to come in a minute, but just to note, we have an item on the agenda about the smoke-free policy, which we'll get into a detailed discussion. So just address the issue in terms of the annual plan, I think was the job for us to do at this juncture. So any responses from Carol, Chris or Teresa may wish to say something on the specific as well. Teresa, os ti eisiau dod mewn ar unrhyw beth croeso.
Diolch yn iawn, Teresa, dwi y cyfarwyddwr gweithredol iechyd cyhoeddus. Diolch am y cwestiwn, Mike, ac am y sylwadau. Os ydych efo'r smygu, mae hwnna'n flaenoriaeth i ni yn bendant fel bwr iechyd, ond flaenoriaeth gobeithio i Ogledd Cymru. Mae gynnon ni darged i gyrraedd dim ond 5% yn smygu ar draws Gogledd Cymru erbyn 2030. Dyna di'r targed sy'n flaenau ni. Her go iawn, ond her da ni angen i wneud, achos mae hwnna'n mynd i helpu ni gyd. Wedyn, bodlon cael sgwrs tu allan, Mike, am y gwaith da ni'n wneud, ac wrth gwrs mae'r polisi ar yr agenda nes mlaen. Ond o ran y pwynt ynglyn â gweithio fo meddygon ifanc ac ati, ydych chi'n iawn, dwi'n meddwl bod yna gyfleoedd gwych bod ni'n cael y sgyrsiau yna sydd yn gwneud gwerth, making every contact count, MEC, oedden ni'n mi alw'n rhen ddyddiau. Mae hwnna wedi bod yr rhaglen go fawr i ni'n Ogledd Cymru, a mae'r partneriaeth wedi bod yr rhan o'r gwaith yna dros y blynyddoedd, a dwi'n meddwl fod o'n rhywbeth ddylen ni ail-edrych arno fo eto, i weld pa gwerth ychwanegol gallwn ni rhoi. Diolch wedi stopio, ond wrth gwrs diolch wrach yn wedi bod yn gymaint o flaenoriaeth yn ddiweddar. Ond be fyswn i'n hoffi deud ydy, mae'r tîm wedi bod yn gweithio hefo'r Brifysgol ym Mangor, a dwi'n gwybod hefyd fod yr tîm wedi bod yn siarad efo rhai o'n meddygon ifanc ni yn y grand rounds fel petai, yn trafod be di'r cyfleoedd o ran ymddygiad, nudge approach fel petai. Felly mae yna dipyn go lew o waith yn digwydd, ond angen i ni wneud mwy yn amlwg o'r hyn da chi'n ei ddeud, a dwi'n gweld cyfleoedd digonedd ohonyn nhw. Wedyn, gobeithio allwn ni ddal fyny wrach tu allan, ac yn modlon iawn rhoi ystyriaeth i heina os fedrwn ni carol o fewn yn cynllun gwaith. Ond dwi yn teimlo fod yna waith da'n digwydd, ond rach ni digon, ac be allwn ni wneud chydig bach yn wahanol wrach ar gyfer y dyfodol. Diolch.
Diolch yn iawn. Unrhyw beth i'ch ychwanegu?
Any additional questions?
Just a couple of points, Mike. I'm sitting here kicking myself now because the full plan's got 5 pages of acronym busting, which I could have just extracted and included in the plan. I just didn't think to. So you'll see it in the full plan. But yeah, we've busted, I think, all of them. But
just with so much to read, having to go backwards and forwards to the list is difficult. So just to clarify.
And again, I think we've done that in the full document, but we haven't done it in this. So we'll go and fix that. We'll go and fix that. In terms of the dental stuff, I think their points really well made. I talked earlier a little bit about some of the work in terms of staff diversification. That's a perfect example. Really of how there's loads of work which actually does not need to be done by a dentist, and what work can we do to improve that so that then we can get dentists doing what only dentists can do. So I've had the privilege of seeing the dental plan, and I know I'm well aware of the All Wales dental strategy, and it sits right in the centre of that.
Diolch yn iawn. Unrhyw cwestiynau neu sylwadau?
Any questions or comments? Dyfed, then Jason. Thank you, Chair. 2 points, or 2 comments more than anything. In relation to the strategic priorities, yes, it tells us what. It may be my ignorance, but the how is what's important. To use what does success look like is important. And also, the trajectories, there are a few figures there on the trajectory itself that maybe raise concern in relation to how realistic this is, and how realistic the targets are, and whether or not it's better for us to under-promise, over-deliver. I'm not sure if it's the right way to explain it, but that we're not setting ourselves up to fail, because people will be very willing to knock us down for any failures, maybe from one figure to 0. It's that balance, isn't it? And that Welsh Government understand that we're being realistic here. Yes, we do want to get to there, but maybe not in the period that we're looking at. Just a few comments there. Thank you. Jason.
To the point that you'd noted around equality, diversity and inclusion in relation to interviews, just to confirm that within the Stronger Together programme, we've got a piece of work this year which is looking at the whole of the recruitment processes in relation to ensuring that staff understand their responsibilities around ED&I. That's reviewed in the Strategic Equality, Diversity and Human Rights Forum, which I chair, which is it's an internal and it's also an external forum of partners. And what our latest data is showing that around about 89% of our staff are compliant in relation to that initial suite of ED&I. However, what I would expect as we go through the Stronger Together work is that we'll probably identify that we need to change the way that we undertake our recruitment to have more values-based interview processes, which the evidence demonstrates are a more inclusive approach really to try and support more diverse people coming to the organisation. So I just wanted to note that there is a process in place in terms of people's understanding and compliance around ED&I, but we know there's work further to do in reviewing the recruitment processes, and that's in training.
Just the ymateb I sylwadau.
Thank you, and just to respond to David's comments in relation to all of the principles around what we're trying to achieve and whether or not we can achieve. Carol and Chris, do you have anything to say?
This is the big question for us, isn't it? The under promise, over deliver. The thinking about aiming high and gets us higher. That's one for certainly a bigger discussion. I guess where I'm trying to pitch us at the moment is about improvement. It's about moving to the next level of improvement. And, in some areas it would be about marginal gains at this stage. So that's why I'm keen to get a greater visibility of the data, a greater level of understanding about what we're doing to make the improvement and the delivery confidence around that, and the learning about what works and what doesn't work. I think it might be helpful. I haven't reviewed it myself. Just yesterday, I think the NHS Wales National Performance Framework was published. You might think, why is it being published in June? But I think they were doing some revisions to it. So I'm sorry to say we will be recasting some of that. But it goes back to a point Gareth made earlier about how much there is really. And I think if we bring that through, we'll be able to demonstrate how much there is. Because there's even more below this, And I think as we work together, on the plan as we go forward, we should be assessing where we are against all of that, and then where our big areas of improvement are. So I'm in the improvement lane rather than the exact science lane, I think.
And I think between what we've been presented today, what we've looked at, and the special measures, we know clearly what we need to achieve as board, as an organisation, and as well as the place we're trying to arrive at, the journey is equally as important, isn't it? The journey and how we progress and the way we work and the way we can have those honest discussions about exactly what we are succeeding at and what we're failing at, and let's be absolutely open about it so that we can improve, as Carol has outlined. That's where we want to get to. One of the great things about progress is you don't have to get 100% of 100%. But what we do have to do is to improve. And I think it's good to underline that, and that people get a sense of, actually, yes, we are making progress. We are taking steps forward. And the way we do that, I think, is important. The way we can support people, the way we can support each other, and the way we can get the learning from across the organisation into all areas. I think that's going to be significant. So we've had a good discussion. There's been lots of work. There's been lots of toing and froing. Really grateful to Chris and the team for everything they've done. We're also for Carol's input. There's more work to be undertaken. I think where we are today is if we are able to note and agree to what's been done thus far. We've all made comments. We've all know that there's more to do. There's going to be further interaction with government and the minister. So today, I think we will say, okay, are we able to agree to what's being presented us today? In the next week, on the next week for 10 days, there will be further work and we will get a response from the government as well. And we will, with the agreement of everyone, we will do that then in a round email, electronic, to get further agreement on what has been added. There's an opportunity in the meantime also to engage with Chris, Carol, anybody that you wish to make further points, so those can be added if appropriate. Gareth, you've got something to say about that, and we'll see if everyone is comfortable with that way for us to progress things.
I'm very happy to, because I completely agree with Claire, and I'm very happy to do what you suggest, that we do it by a formal written procedure, as long as we can do that. And I'm so sorry to be ignorant about that, but I presume that when you send it, you've got to say this has been approved by the board on such and such a date. Yeah. So I think we just need to be clear that as long as we can say, you know, the overall strategy was approved by the board on 22nd and the detail has been signed off by written procedure, then if we can do that, then I'm happy with that. But I do think we need to have that formal opportunity, even if it's only 24 hours, to look at it. Yeah.
So Carol, as the accountable officer, you will be able to confirm that, please.
I wonder, Gareth, if we might agree a term of words that say that we agree this is a working plan, bearing in mind the issues of the finance, and we are doing more work on that. We can't be satisfied as a board with where we are, with a financial deficit plan of 134 million and where trajectories are not yet where we would be. I think that would be an important signal, but the fact that we've given it at least an hour's good airing, we're going to have more opportunity to do that over the coming week. My sense would be that would be acceptable.
Thank you very much, Carol. Ydy pawb yn hapus I ni wneud hynny?
Is everyone happy for us to do that?
Yeah. Diolch fawr iawn. So by a week today, there will be further opportunity to confirm further detail that will have been worked on over the next few days. Iawn, diolch fawr iawn I bawb am y cyfraniadau a drafodaeth yna.
Thank you all for your contributions and discussion. The discussion reflects where we're at, I think, as a board, and the need to have more detail and input as a board to some of these plans and discussions, but very grateful. Lots of work already happened. Item 9 is the Special Measures Change Control Report.
You may have a word to say about this, please.
I'm hoping this is a very short item. It's a minor modification from the response plan that we agreed at the last board meeting, which I would add is, I think now gaining some real traction. We had a very positive catch up with senior leaders across the organisation around the response plan that was approved by the board, and a whole host of further engagement opportunities with colleagues. But there was a point of detail that we wanted to bring through, so over to Chris.
Thank you, Carol. So at board, we approved 40 deliverables in May, and the change relates to the ones regarding finance 2.2, 2.3, 2.6 and 2.7. And Steve has had good conversations with the independent advisor for finance, for colleagues with Welsh Government, and it's important to them to have tweaked those deliverables a little bit to enhance them, and in so doing have then introduced a 41st deliverable. We don't believe that the change is materially different, and we were keen to support it because it made a difference for them. But because this came and was approved by board initially, we felt it was right that it should come to board for approval. In the meantime, our internal group, which is a special measures review group, which is made up of senior leaders across the organisation, have looked at this and are supportive of this change. And so we're working to the revised deliverables pending the conversation today.
Diolch yn iawn. Chris, a'r argymhellion fel y gwelwch chi ydy...
Recommendations as seen as to note the work of the group and to confirm the changes. Any questions or comments? Everyone happy? Thank you for that. And thank you for the work. Next item is item 10. So no smoke policy. Papers have been presented, and as we normally say, we assume that everyone has read those papers in advance. So I'll turn to Teresa, is it? Jason. Thank you, Chair.
So the first part of this paper will be myself, and then I will hand over to Teresa as our public health specialist. So just to confirm that this paper's here today for decision. It's been updated through the relevant groups, which includes the Workforce Policy Group, which is represented from our staff side colleagues, and also it's followed the process as well through the Quality and Safety Experience Committee, and that took place this week. You'll note within the pack that this also has quite an extensive review in relation to the standards and the implementation around smoking. It's fairly clear from the pack that some of this is statutory, and it's about our statutory obligations as a public body, but also as well what the paper also notes is as a healthcare body in terms of acting as an exemplar, what our approach could and should be in relation to vaping. And I'll ask Teresa to come in at that particular point. So some of the key changes are about trying to ensure that staff are very clear around their roles and responsibilities through their contractual requirements, but also as well to ensure that our services are clear as well in relation to how we support patients and service users who have smoked really. The policy notes quite clearly the definitions of smoking, and you'll see there in terms of tobacco and so on. And also within the policy, we note some points in relation to vaping. So probably what would be helpful at this point is if I hand over to Teresa, and then she can note the particular key points of why, what the public policy changes are within here, and why we're trying to implement this policy as a health body.
Diolch Deirydd, diolch Jason. Gathon ni sgwrs da.
Thank you, Jason. We had a great meeting in the Committee for Quality and so on the other day, and vaping came up as a topic, and it's a pretty complicated topic. It's not the same as smoking. We're still learning about vaping at the moment. It is an area that raises concern for someone who's in public health, because we know that vaping is on the increase amongst our children and young people. And here in North Wales, and it's younger children. Children as young as 9 years old vaping, which is a concern for me. Vaping can help some people to stop, but with the evidence that we have at the moment, we don't know what the results long term will be. And then, in relation to the report in front of you, vaping is included there because it's a simple way of addressing the topic whilst we're awaiting a statement from Welsh Government this summer, which will help us then in relation to our site as the health board because of the concerns that we have in relation to what the long-term results will be. I think vaping should be the same as smoking, and it's not something that we want to encourage at all across our sites, and we want to stop. But we can't force people to stop vaping. But with smoking, it's pretty clear what the legislation expects us to do. In the QC committee the other day, one of the conversations we need is we need to help our staff and patients to stop. That's very strong. And we do have services now across the 3 sites and across our services and a special team who are doing great stuff. So I'm confident that we can help people to stop smoking. But at the moment, when it comes to vapes, we can only provide some assistance in relation to behavioural support. But I do feel positive that there will be a statement in the summer, and I do feel that people across the whole system are discussing this. There were a few things that arose in the last committee, and just an opportunity to discuss these briefly. I know people were concerned that the assessment on the BCUHB wasn't available before, but I have checked and the work had been conducted in November, and thank you to Jason's team and the occupational health team for leading on that work, and a team of people across the health board who have given some input into that EQEA, and also in relation to mental health. That became live in the legislation later, but I can confirm and assure members that the risk assessments have taken place, are in place. Excellent work has happened, and we'll need to update the risk register. Has the most up-to-date information. Because we don't want staff to have too much secondary scope. The inhaling secondary care. We don't want staff to have more problems and great stuff. So staff and patients are addressed at the same time, and maybe we'll have an opportunity to discuss the work about smoking if the chief exec is also happy in a workshop or something, because there is great work happening, and what you have here is the policy today, but I'm so pleased that it's coming to the board, that it's visible for us, to us as a board, but also to society. And I'd like an opportunity in months to come to have a discussion about this topic in particular. Thank you. There may be an opportunity for the committee to have some details and to learn more about what is happening operationally as well. The report was discussed in the committee, of course. The other day I had the pleasure of observing that committee and Rhian's chair. Anything else as the chair, Rhian, that you're keen to raise? Otherwise, I'll turn to Gareth for comments. No. Teresa has conveyed the content pretty comprehensively.
I just wanted to say I have no issue at all with the policy. I've never smoked and I don't vape. So I'm not taking issue with vaping, that we should have the same approach. But I was just concerned that I didn't think it was particularly clear. And I think my concerns could probably be addressed by being very upfront in the introductory paragraph, saying because particularly what I wasn't clear about was vaping gets mentioned quite late on, and then it's not mentioned specifically in section 10 or 11, which is on patients and others entering premises. So I just really want a point of clarification. I think I know what the position is, but just so that everybody reading it isn't in no doubt. And the fact, and I quite understand why that is, that we've hung it so much on the legislation, and because the legislation doesn't cover vaping, it gets a bit confusing. I mean, I'm very happy to just, again, approve this subject to somebody tweaking that. And from my point of view, it is only something very clear, probably a sentence in the introduction, but I think that would just strengthen it, and so that people were in no doubt about what our stance was.
Gareth, Vaughan, you ddod mewn, Mike, a wedyn na I ddod at Nick.
Been answered to some extent. After a visit to Ysbyty Gwynedd, when I spoke to a member of staff about people smoking outside of Ysbyty Gwynedd, there are more people standing around, and what I was asking what the strategy was to that individual about moving people on. And what she said was that staff are challenged significantly by people outside of the hospital, almost to the extent we almost need security, she said tongue-in-cheek, because they can be pretty aggressive about what we're going to do about it. So enforcement of the action is an additional resource. That's just one hospital, and that was before the Caban coffee outside, so that is an area and something that we need to consider and address, and so that people understand that it's not acceptable. Some patients were in wheelchairs and tied to all kinds of medicine and so on. So I was pretty angry as a taxpayer, and how will it be acted upon then? I'll come back after the other comments. In the other committee, I did refer lightly to the fact, but every site that we have, there is a sign that says you will be fined £100 if you're caught smoking on site. And I was asking, tongue-in-cheek, how many £100 had been collected. But how do we protect staff that try and act upon the policy as well? And what do we do to take the steps? It's a complicated matter. Mike. Then Teresa to conclude. Mike.
Quick question for Teresa. I know the evidence is still accumulating on vaping. Have we got to the point where we should be offering staff and patients advice on how to quit vaping, or are we not clear on that yet?
Da ni ddim yn y sefyllfa yna ar gyfer veipio ar hyn o
We're
bryd.
not in that situation for vaping at the moment, I don't feel anyway, but if we talk to some of the clinical staff, they do see that there is a benefit for people who try and stop smoking. And that's the thing, we need to help these people. We discussed the addiction and we need to be clear and we need to help people, but we do have a plan. The new work is that we have teams at front doors. I think it's only one without a team at the front door to help staff and patients so that they don't have to smoke and that we can give them patches and so on. So there is great work happening. So there is an opportunity. And I'm happy to talk outside, but as far as the vaping, things will move forward. There is work happening across England at the moment, but Wales want to go further, so they're collecting their own evidence as to what is happening with vaping, and I think it'll be the summer and the new year maybe before we see more work happening. So steps are being taken. nationally and regionally.
Yeah, thank you, Chair. Just picking up on Vaughn's point, really, I suppose. People watch us as leaders when we visit sites, and I guess, therefore, we probably, all of us in the room have a responsibility not to walk past people who are smoking without picking them up and without having those sensitive conversations, because whether we like it or not, if we do so, we're probably seen, what does that say about our leadership and really supporting this policy if we approve it today? And it gives staff an excuse to say, well, if they don't pick up, why should we? So just reminding ourselves of our responsibility, recognising I dread those conversations personally, but we do need to do it ourselves.
Yeah, that's a very good point, and underlines the leadership role that we all have in everything, actually, but particularly when we visit sites. So, Claire.
So happy in principle to approve the policy, and one question for Jason, really. I feel within here the kind of support being offered to staff is very procedure. So it even says how many sessions and over how many weeks. I would just ask that I think, this is about supporting our staff to deal with an addictive behaviour that is recognised as such. And I would think it doesn't matter, surely, and I hope our policies will be the same. If somebody came to talk to us about an alcohol addiction, we would offer as much support as we could, as frequently as we needed to, for as long as we needed to both help that employee deal with something that's having an adverse impact on their health, rather than have something that reads to me here not. From a kind of culture and supportive perspective, I think we need to do more. So I would say I'm happy to support it, but I would request that we kind of tweaked the wording around the support that we're prepared to offer to our employees, because I think that's important. And then there's the final point is, and it's a governance bit again, sorry, is this was a law 2 years ago. So how many other things have we got that are going to kind of come out of the woodwork in the next few months? And do you have any chance that directly? Because I guess it's a bit facetious, but these aren't things that someone said, it'd be nice if you did this, Betsy. It was like, we should have done this 2 years ago. So that bothers me.
So the point is that any programme can be shaped around the needs of the individual, and there's that flexibility, and not completely following sort of line by line. It's patient first, and patient first, if we can copy the patients. But Jason, a brief word from you.
Yeah, no, absolutely. The way our health and wellbeing services,
and why we're adopting it today as well, if you can explain that, that'd be helpful as well.
Yeah, so I think this in some ways is about us being an exemplar, and in relation to our staff, we do have those. We are practical, so like many services as well, we need to try and set some level of boundary, but we recognise that not everyone will meet that level of tolerance, and they'll need additional level of support. And so, with our in-house occupational health service, we will support that. We're actually the only occupational health service in Wales that's CQOS accredited, and so we do have a good service that sits there. So I guess that was the thing I just wanted to pick up, really, just in relation to those points. But the final point is, this is a policy iteration where it's been going through, and there was a review last year, so it's not something which is it's something which we've forgotten to do. I guess what this is, it's an updated version as things have been changing, predominantly in relation to both vaping and also the clarification of the contractual requirements for staff to follow the process and policy.
Diolch yn iawn. So Claire, I think Jason explained it. This is an updated situation, so I don't think that's very clear in the paper, so that's something to bear in mind when we are refreshing and updating. Refer back to when something has been endorsed, and then we know then exactly what the purpose is today. With that in mind, are we all happy to approve the policy? Pawb yn hapus I gytuno, os gwelwch yn dda. Pawb yn hapus? Diolch yn iawn. Diolch am y trafodaeth.
Thank you, and thank you for the discussion, and thank you for all of the work on this important item. The next item is the report of the Quality and Experience Committee meeting 2 days ago, if I recall correctly, on Tuesday. Rhian was the chair, and I had the privilege of joining that meeting. Just to have a quick idea. There is a written note of previous meetings also.
Right. This isn't a report as such. All this piece of paper does is more or less tell you what was on the agenda. And we've had two committees, two shorter committees, and you can see the sort of things that we looked at. And I think it would be fair to say that we spent a fair bit of time considering what the committee should be and how it should be conducting its business, and what I would like it to do over the next 6 months, 6 to 8 months, while I'm still going to be here. And I think we agreed that we would meet monthly. They would be fairly sharply focused. And I was never, ever going to have 600 pages worth of stuff ever again. Otherwise, I would walk out of that particular committee, and I mean it. So I think it's very focused papers, and that we are looking at we're looking at how all of these things feed into the strategic objectives. I mean, that's what Welsh Government guidance says QSE is meant to be doing. And I'm not quite sure that is what it has been doing in the past, and maybe it's been, maybe more operational. I found it fascinating reading some of this stuff. I knew nothing at all about it. Gareth says he doesn't have a health background. I don't either. And I found it all very fascinating. And I thank Dyfed for observing, and I'd like to thank, although they're not here, the independent advisors, one of whom is almost a mentor to me, bless him, and another two who are very supportive. So I'm getting support as a new chair, and I think the committee I think we get rubbing on reasonably well, and I was delighted that Claire could join us for her first meeting as well. But happy to take any questions on, what did we actually do?
Angela.
It's not about what we actually do, because obviously we were there, and I think it's evolving as a quality committee. I think we've got the direction we need to go in. We know we're working on the work plan and taking things forward. It's a really good opportunity to identify it's a proper assurance committee, and what we're actually bringing is going through the appropriate routes. From the committee report, I just wanted to note that we need to change the meeting dates aren't in here properly, and we just need to make sure that is identified. It was a May meeting and a June meeting, because the first bit, summary of business, was the May meeting. So I think we just a little bit of clarity on that.
Oh yes, sorry, it was the next meeting wasn't the 27th of July.
No.
It's been, and we will be monthly from now on. So we need to mesh it into a calendar so that it can feed into board and other things in a sensible way. So I think the point is we're still a work in progress, but I'm happy that we're going along the right track.
Absolutely.
Diolch yn fawr, Rhian. Diolch am y gwaith ar hynny.
Thank you, Rhian, and thank you for the work.
Yes, thanks very much. So I just need to be really clear that our executive and assurance committee operations need development significantly, I think, at this stage. But really, you're absolutely right. These are assurance committees, not management committees, and I'm slightly nervous that, by virtue of the length and depth that you will be in operational territory. Now, we are will be strengthening the executive oversight and scrutiny of issues before things come to the board committees, which is the right and proper thing to do. Otherwise, there's no way we should be asking you to manage the quality agenda or the finance agenda. We've got to assure you that we're doing that. We are due to get the review of one of the reviews under the special measures that helps us with governance. And of course, we've got our board development work to do on that as well. So my sense would be, Chair, that we keep our evolution under review, and we take into account the findings of those reviews that help us along the way.
That's very helpful. Diolch yn fawr. Felly, ydy pawb yn hapus i dderbyn?
Is everyone happy to accept the report? Thanking Rhian for the work. Thank you. Excellent. On then to the concluding matters. Item 13. Items to be referred to committees. I don't think there is anything. So in addition to all of the work in relation to the plan, that everything will be coming to committees, discovering new risks or identifying new risks. Don't think there are any new risks that have been identified today. Summary of private business. Anything to add?
Yes, diolch. This is to just report on what the private business from previous board meeting was that we discussed. That's a function of this item. So we did a review of the last board meeting. We also took a paper on the radiology information system procurement. We took a paper on our relationship and ongoing work with the health and safety executive. And we also undertook a high value claim for 2 individuals from the last previous meeting in the private section. Thank you.
Diolch yn iawn. Ymlaen felly yr eitem ola sydd gyda ni.
So the final item is to note the date of the next meeting. I can confirm that we are in discussions about that date because of some demands on people's time, so we'll confirm that date shortly and in the next few days. At the moment, we're on the 27th of July, but we are looking at the potential to move that date. We'll see. And if we can't, then we'll stick to that date, and that's to be confirmed in the next few days. So that's the end of the meeting, and thank you all for your contributions. Thank you all for the preparatory work and in the background to ensure that we've been able to have a meeting here and all of the necessary arrangements. It's not an easy matter. There's a lot of work behind the scenes. So thank you. Thank you for the translation, which is always appreciated, I'm sure. So thank you for that work also. And I bring the meeting this month to an end. Thank you.